I am Dr. Soumen Roy, GI HPP surgeon, especially liver and pancreas specialist, consultant at AMB Hospital, Bhubaneswar. I today welcome you to the World Liver Day. I just will give you an insight regarding the liver and its problems and how to deal with it. Okay, do you know it is the largest organ in the body? And very importantly, do you know it secretes cholesterol also? So basically, liver has a vast range of function. It starts from your metabolism, your functions, and bile synthesis, medications, everything. It is a huge role to play in the body. Okay, so what does it do? So whatever drugs you take, whatever food you take, it all gets digested and it's get metabolized in the liver, and whatever you eat and how you behave in your lifestyle, it also affects the liver. A very common problem in our society is coming with this is the fatty liver. Fatty liver per se, it is not a problem. It is only treated once you consult the doctor, your liver function test, other diabetes, cholesterols are deranged, then only they are treated. But it is over the past few years, 10 years, we have seen so many patients, young chaps, coming with fatty liver and ending up with it is called as NASH, that is non-alcoholic steatohepatitis. Those don't who have hepatitis, they are called as NFLD, that is non-alcoholic fatty liver disease. It has become a pandemic since 5 years, 10 years. So what is that fatty liver? When you take excess of fat, even if you take carbohydrate, excess of carbohydrate, it gets deposited in the liver as well as in the kidney, pancreas, heart, blood vessels, and heart and other organs are not tolerated to the fatty acids, but liver can tolerate for too many years. When it is excess, the damage becomes excess, then there are changes in the liver. The liver cannot repair it. So that leads to fatty liver hepatitis. That is called as non-alcoholic. Why it is non-alcoholic? Because alcohol is the common cause that damages liver from besides the hepatitis B and C. Non-alcoholic steatohepatitis, it is very common in people. It is not very severely affecting the body, but people are neglecting. Slowly, those are coming in medical science. Research are going on. Too many research are going on. That India, it was very common in European countries and Western countries. Yes, but right now in India, it is slowly growing because of the Westernization, because of the diet, because of the unhealthy food habits, because of the urbanization, because of the lack of exercise. It's simple, and it is affecting the cardiac and the liver problems very commonly seen nowadays. So, wholesome body, you should take care of your whole body with proper diet, proper food, and proper exercise. That is the main motto. How does COVID affects liver? Does it damage liver? Usually, per se, COVID virus doesn't affect the liver too much. But yes, a lot of studies we have seen that as liver enzymes are affected. Again, it is because of the immune reactions of the COVID. What are the causes of liver cirrhosis? First, there is a fatty liver or initial damage. Over the years, it goes to fibrotic, means liver has become stiff. If the damage persists, it goes on to end stage. That is called liver cirrhosis. Liver cirrhosis is not irreversible. First, most common cause is alcohol. Continuous intake of alcohol. It depends on person to person. It's not that somebody takes one drink, two drink a week. It doesn't matter. The person's body, how the body metabolizes, how his liver, how extra damage has been done, like smoking, fatty food, sugar, refined sugar. These things also damage the liver. These add on the liver damage along with alcohol. How does yeah to keep liver healthy, can we take medication every day if the person is alcoholic or excessive alcohol? It's a nice question for you. But if you are alcoholic, there is no medications will help you. Simple thing. Liver is a factory. It's like you have a car or a bicycle. There is a piston going on. You apply oil, you apply grease, and there is sudden bombardment. The mechanism the car runs, and you repair. It continuous maintenance. You travel along. If you hit too much in the RPM or torque, there will be pressure in the engine. But it depends. The car will move, but after some time it will break down. You will need oiling. You need maintenance. That's why in liver also, once continuous alcoholism is there, you take alcohol, the liver repairs, the liver goes on. But with time, if it is increasing and the damage is increasing and you are not repairing or you are not protecting yourself, then the damage becomes irreversible. No medications will help. So the best thing I would suggest, stop alcohol. There is no point in taking alcohol along with medications. There are only few medications that are protective, but that is not to be taken along with it. The best thing is to do exercise proper time. That will. How does oil and fats affect liver and heart? It is related or not? Yes. The very important thing I would like to tell my audience that do you know that liver synthesize or it makes prepares cholesterol inside your body. It is not that cholesterol you are taking from outside. That is extra cholesterol. But inside the body, your liver prepares cholesterol. It is a mechanism. Cholesterol is not per se bad. Your fat, fatty acids, there are lots of things. In whole combination within a certain parameters, it is protective to the body. When it goes above certain level, it gets deposited in the liver in the form of fatty liver. It gets deposited in the heart in the form of dyslipidemia, your hypercholesteremia, your blood clogging occurs, then you suffer heart attack. Heart is not tolerated, but liver is tolerated. It takes years to get the liver damage. So best thing is the ghee and coconut oil. Those are not damaging. You need to understand that per se oil is not bad. The conditions you put, the conditions, the amount you take, that is important. Third best is the mustard oil. So at higher temperature, they are not toxic. The amino acids that trans fatty acids levels are maintained in that oil. But in the Western diet, in the European diets, they use refined oil because they use very less oil. They don't burn too much. Their food habits are different. So we need to understand our system and our research only. So another questions like what are liver function tests? Okay, liver function tests are 5-6 tests you must have seen in the laboratories like bilirubin, direct unconjugated. There are few parameters, OTPT, enzymes levels, and alkaline phosphatase. There are 5-6 parameters. I am not going into detail. Each parameters subject to a different problem. Okay, it is not that only bilirubin, it's not that only alkaline phosphatase, it's not that only enzymes. Like if OTPT, I will tell to the audience, if OTPT like SGPT, SGOT or ALT, AST, that part is affected, that means liver enzymes has damage. They have affected like in hepatitis, alcoholic, variety of conditions. It is to be monitored with the help of a doctor. Does COVID vaccine have effects on liver and major side effects? No, no. COVID vaccine is usually safe. See, it is very now because of the sensitization, because of the pandemic, everything is in news. Not even a single side effect will make the headlines. Do you know you are taking pantoprazole, a acidity drug? It has certain side effects. So many medications, if you Google searches the percentage of the side effects, it is too far higher than the COVID vaccine side effects. So it's yes, a lot of myths are running around, but obviously vaccine is safe. You should take only mild reaction allergic as usual for any patients. Any drugs can happen. You should consult your doctor, and obviously that is the only one thing available till now to protect against COVID. It doesn't have any side effects on the liver per se. Is there any marker test for GI cancer other than endocolonoscopy? Oh yes, there is a test called CEA and CA 199. These are the two main tests. That is more commonly seen in the GI cancers and the liver cancers. Another one is the AFE, that is particularly based in the liver cancer. The best thing is to maintain healthy lifestyle, wealthy lifestyle. It will take care of your brain, it will take care of your heart, it will take care of liver, pancreas, everything. Not per se only liver. Your oil, your diet. The most important thing I want to tell that it is not important that if you have diabetes you will avoid sugars only. No, if you should avoid carbohydrate, excess of carbohydrate. You should consult a dietitian. Doctors will guide you. They will prescribe your medications, follow up, monitoring. But for proper diet, you should consult your dietitians nearby or doctors. Uh, you have diabetes because your pancreas is not able to secrete properly insulin. Okay, so now somebody is taking tablets and somebody may be taking insulin. A few people with time land up from medicines to insulin, or it may happen reverse. Do you know that receptor, that particular molecule on which your insulin will act, and all those cholesterol molecules, those are secreted and are prepared inside the liver. So obviously, liver affects these things. So it is a triangle kind of thing. It is called a metabolic syndrome. Diabetes, your hyperlipidemia, cardiac, and fatty liver. These are all interrelated. One affects the other. And if the center part is your diet and exercise. If you control regulate, these all three things can be controlled. Now, simple thing about okay, how will we detect? The see, if you have any liver is an organ that it will not cause any problem. You will not per se find any problem that you will consult doctor that I have a liver problem. It is usually detected on test. Usually, majority of the cases will have gastric acidity. Commonly, people on investigation on liver function tests, we usually find out liver, fatty liver, or certain things. And in certain cancers or in severe cases, there will be jaundice, yellowish of the skin, urination, and on blood test, we find the patient has jaundice and liver problem. And in certain kind of stones, if it is blocked inside the liver or the bile duct or any tumor, it is get blocked, you will have jaundice. Very few people have pain because liver is not a painful organ. So that's why in very advanced stages the liver cancer and liver tumors are detected because by the time they come to us, they are very advanced stage. So usually it is detected on ultrasound scan. Majority of the fatty liver, tumors, small, all are detected, whether you have gallstones, everything. And then for proper diagnosis, you should consult the doctor. And if relevant, then we do CT scan. What the problem, what is the diagnosis, what is the problem. And along with the lefties. This hepatitis is preventable. Okay, so hepatitis, there are various types of hepatitis A, B, C, D, E, and G. There are few little things you can take care of your liver by eating those things. Like for example, green tea, black coffee, not too much, not with sugar, sugarless. Even if you add sugar, then there is of no use. Black coffee has been found to prevent liver cancer. Avocado, berries, fruits, carrots, turmeric, honey, these are all very protective of liver. Those are very natural benefits. You should add to your diet. You should add to your diet. Apple cider vinegar, those are very pungent, but usually you should not take normal people, but those who are alcoholic, they have liver damage, they should add a little bit, 1 teaspoon of apple cider vinegar daily in a cup of water. These are very effective cleansing liver. Avocado is very good. Berries. But today the berries in the markets are coming with artificial sweeteners. They are not good. Direct taking fruits and berries are good actually. You should take care of your liver. You should take care of your own health properly. Whatever liver, heart, everything. You should take care of your own body. Eat healthy, live healthy, stay healthy, wear masks, don't move out for the next 15 days or 1 month. Do your work by proper distance and mask. Take care of yourself so that you can take care of your family. and be safe, stay safe. Thank you everyone.